Welcome back to Dr. Arshad Nadeem Awan radiology and ultrasound teaching videos. Hope you're all okay. Today I'm going to discuss about a disease of the childhood which is called as Perthes disease. Perthes disease is actually idiopathic disease. It's avascular necrosis of the epiphysis of the femoral head. Epiphysis of the femoral head becomes avascular and it becomes necrotized, so this is called as Perthes disease. Perthes disease is usually seen in 2 to 6 years of life, but it may vary from 2 to 14 years of life, and in 10 to 15% it happens to be bilateral, but in majority of the cases it would be unilateral. On the radiograph there will be two types of the sign. There will be an early sign and then there will be a late sign. In early sign, what happens, there will be a joint effusion, especially on the medial aspect of the joint. You will be able to see the joint effusion. The second thing is, so far the femoral head epiphysis is concerned, it will be density, its density would be increased. And the second thing is the epiphyseal plate would be blurred, and there will also be lucency in the distal metaphysis. At the distal end of the metaphysis there will be lucency. And another important thing is there will be asymmetrical epiphysis of the femoral head bilaterally, so you will be see the affected site would be a decrease in size, so there would be a asymmetry. So this would be the early sign. You can also pick on the radiograph. The late sign cannot be forget, so there will be a distorted and fragmented epiphysis of the femoris. The second thing is there will also be abnormality like which called as a burnout stage. In the burnout stage, what happens, this femoral epiphysis will be smaller, shortened, widened. This would be called as coxa plana. So this would be the end stage or burnout uh, stage, you can see. But in the distal in the proximal metaphysis there will be a multiple lucencies can also be seen there. So this is all about the Perthes disease. How you will be able to appreciate on the x-rays and on the radiograph. Let's start watching these images regarding the Perthes disease. Perthes disease is actually idiopathic avascular necrosis of the femoral head, and here on this image particularly you can appreciate that the femoral heads are necrotic, and this is seen in 5 to 6 years of age. So you can appreciate well that as compared to the right and left, one of towards the left side femoral head is deformed, small in size, sclerotic, and it shows avascular necrosis. So this is Perthes disease. Here a close image has been shown to you. Look at that, the size is reduced, sclerosis and slightly lucency can be seen in the metaphyseal, adjacent metaphyseal. So this is avascular necrosis of the femoral head, and this is a Perthes disease. A close projection can easily seen that the femoral head is deformed, it's gone down, it's sclerotic and it's flattened, and this is because of the avascular necrosis. These are the MR images, and both right and left can be shown. So this was the previous case which you have seen on the simple and plain radiograph. Here you can appreciate that the femoral head is deformed, the femoral head is flattened, it has lost its architectural integrity, and it is also showing an abnormality of the signals as well. So Perthes disease is idiopathic disease. It's avascular necrosis, and it involves femoral head epiphysis.